Okay. Good morning, everyone. Thank you for taking the time to join us today. For those I haven't had the pleasure of meeting yet, my name is Courtney Hartman. I am the health specialist here at URL on the Health Plan Options team. If you have any agent support that is under 65 individual or group markets, please feel free to reach out to me or anyone on my team as we are here to help. Before we get started, just a few quick housekeeping notes. To minimize background noise, please make sure your microphone is muted during the presentation. If you have any questions, use the chat feature located on the right side of your screen. You can also see the slides to download under the handouts tab on the right-hand side as well. With that said, I'm thrilled to welcome Alyssa and Patrick from Aegis as we move through a busy fourth quarter and encountering notable renewal increases. Our goal is to ensure you to have the right tools and strategies to manage rising premiums effectively while helping your groups and employees maintain access to lower deductibles. So please join me in giving a warm welcome to the Aegis team.
Thank you very much. Again, I'm Pat McGovern, and I'm here with Alyssa Pinaya. Please say hello.
Hi, everyone. Good to see you. Thanks for joining us.
We very much appreciate you giving us a few minutes of your time to discuss the GAP program. We feel like we may be able to offer a product that would be mutually beneficial to both yourself and to your clients. With that being said, I do have the Q&A open on my screen. So if you have any questions that come up during the presentation, please feel free to hop in at any point to ask any questions. This is a pretty simple product. It's not overly complicated. So this is not something that is going to throw me from my discussion points that it is so complex that I would get lost. If it is, I'm going to have some serious problems tying my shoes later on today. With that being said, just to give you a quick background, Alyssa and I work for Aegis General Insurance Agency. We act as an MGU for multiple carriers across the country. We've been operating in the GAP space now for close to 20 years. We've been around for as long as GAP has been around, as far as I'm concerned. We've have a very large and healthy block of this business in Pennsylvania and has continued to be successful and grown over the years. So we're excited for the opportunity to possibly share it with you and expand our footprint. I'm going to jump into some quick facts that I'm sure you're probably already very well aware of, but we like to try and drive this home. If you can actually see or read on that. By the way, we do have these handouts, I believe, are included in this presentation, so you can peruse them yourself when you get an opportunity. But the key points here that we're talking about was that the Kaiser Family Foundation, has put out a lot of facts about the rising costs of health insurance. Lots of theories as to why it's going up. I'm not going to venture down that rat hole, but the reality is that since 1999, health insurance premiums have increased by 365%. This upcoming year, we're looking to see probably between a 6 or a 7% jump, and that in a recent poll, 4 out of 10 insureds adults are aware that they're not going to be able to afford their monthly health insurance premium. Right now, companies are likely to spend more than $18,000 on average to insure each worker in 2026. So this means that if employers are going to be spending that kind of money, that the employees also can expect to see a commiserate bump in what's going to be coming out of their paycheck. So where does that leave us? That's where GAP can come in. GAP is a way to possibly lower the premium while keeping the deductibles in a more stable situation. And at the same time, it offers a competitive commission level, traditionally higher than your major med. So it's a way for you possibly to generate some additional revenue while actually saving your money some clients. So obviously the question is, how on earth can that happen? And the reality is that, wait, I'm going to make sure I got to hit the next button here. I'm still learning how to drive this thing. So Gap doesn't have any kind of magic elixir here that suddenly lowers premium for no apparent reason. What happens is that major med carriers, when they are looking at their billions and billions of costs in working on their major med plans, they will create factors on to move deductibles from 500 to 1,000, 1,000 to 2,000, 1,000 to 5,000, whatever it may be. And when they are looking at these billions of dollars in expenses and $1 million limits, there are often times where they will accidentally overvalue the impact of raising a deductible from 5 to 5,000 or what have you. And as a result of that, that is where GAT can come in. We are operating below the equator on these small limits of $3,000 to $5,000 benefits. So we have been doing this long enough that we know exactly how much that benefit costs. And that's where Major Med is worried about claims all the way up to $1 million. We focus on this $3,000 to $5,000 layer, and we consider ourselves very much experts at it. So when we find these Major Med deductibles impact, there are times when we're able to save the client's money. What we say, though, is that it doesn't always work. I don't want to oversell this and say that every time you send us a quote that we're going to save you money. That's not how it works. And if I was saying that, I would suggest that you would be very concerned about anything that I said. So it doesn't always work. There are times it depends on the industry. It depends on the number of people. It depends on the benefit. It can vary very greatly depending on what you're working with. But what we say is that getting a GAP quote is an extremely easy process. We're going to share with you the process in a little bit. And what I tell people is that if it takes you more than 10 minutes, 5 minutes to fill out a quote request form, you're doing it wrong. It is very, very quick to be able to fill out the information that we need to be able to offer you a proposal. And what we say is that either we're going to save you money, or if we don't, if nothing else, when you present your renewal to your clients, you can go through and say, I looked down this avenue. I looked down that avenue. I pursued a GAP quote to see if maybe I could save you some money that way. And that didn't work. So if nothing else, you're able to present to your client that you've pursued as many avenues as possible to try and save them money. So we consider it a win-win whether we're able to sell you or not. We're able to get you a quote. We're able to possibly help you. And even if we don't, we can help you in your presentation to your client. So I will get off my soapbox on that. We wanted to get to some frequently asked questions. What is the minimum group size for GAP? We can go down to all the way down to 3 employees. Our sweet spot tends to be in the neighborhood of around 20 to 25, but we have groups as many as 500. Alyssa, is that fair? Am I saying that incorrectly? Or
No, you're correct.
Okay, just Alyssa, make sure that I'm not wandering too far off the reservation. Another question we also often get is what happens if someone is on the GAP plan and they go outside of their network? The way the GAP plan works is that we follow the Major Med EOBs. So what that means is that if somebody goes, a group has a $5,000 deductible and an individual goes out of network, and as a result, they are penalized and only pay 50% of the benefit. that means that the gap would only pay 50% as well. We follow the major med EOBs, so that if it's covered and applied to the deductible on the major med, it's covered and applied to the deductible and the benefits in the gap plan. So that's the very short answer. Another question that often comes up are about professional fees in a doctor's office. So you can go in and you can have tests done, et cetera, and that would be covered. But professional fees are often what is considered covered under your copay. So when you go to see a doctor and you have a $50 copay, and there's a $250 professional fee, what that means is that that individual would pay $50 and then the major med would pay the $200. Gap doesn't come into play on those professional fees at all because it's covered on the front end between the copays and the major med plans. Can Gap offer prescription drugs? The very short answer is yes, we absolutely can cover drugs, but I will also be very blunt in that it's very expensive. It's something that we can do. To be brutally honest, I don't consider we're particularly great at it because it is a very pricey benefit. Additionally, with major med covering prescription drugs, it's all covered through their card and is taken care of, wherein under the GAP plan, they would have to submit the bill to be reimbursed and we would pay that way. So, I'm being completely straightforward with you. It can be done. It's not something that we do a lot of because generally the major med can handle the gap better than we can. Can handle the prescription drugs better than we can. Obviously, one of the big topics today are health savings accounts. And the question that we will often get asked is, can you have a gap along with an HSA? And the answer is yes, you can. It can get dicey. You want to make sure that you're following all the rules. Right now, for a plan to be HSA compliant, there needs to be a minimum deductible for an employee of $1,650 and a family minimum deductible of $3,300. So for you to offer a gap and an HSA, just to keep it simple, for an individual, that would mean that the gap plan would have to have at minimum a $1,650 deductible, and then benefits could kick in for gap before it went into the major med. We are definitely not tax experts, so we recommend you make sure that you talk with professionals to make sure that you're doing it right. But the short answer is yes, you can offer gap on top of HSA. There are minimum deductible requirements along the way for that to happen. I promised that I was going to show you how to go about getting a quote. And I don't know if you're really going to be able to see on your screens, but this is literally all that needs to be filled out is the basic information on the group and the individual and major med deductible and the number of employees, employee and children, employee and spouse, family. Like I said, if it takes you more than 5 or 10 minutes to fill that out, you're doing it wrong. Once you get that, you send it over to Alyssa and her team, and we will in turn fire a quote back out to you. And that quote looks like the following. Again, it's a simple one-page document that would spell out the rates based on the census and would give you the anticipated monthly costs. We wanted to give you a quick example of what it would look like to, there it is. I apologize. I did not hit the button yet. This is what the proposal looks like. Again, it's one page, spells out what the rates are going to be. And all they need to do is sign it and send it back to us, and then we're ready to rock and roll. Wanted to give you a quick example of how the gap would work is that on your left, you'll see what a major med $1,000 deductible plan would look like. and the annual premium for this small group would be $81,264. If they went to a GAP plan that had a $5,000 deductible, they got a 19% discount. And then the GAP plan was able to bring the $5,000 deductible right back down to the $4,000. And that made the annual premium for the program be $73,980. So in this example, we were able to save an employer $7,284 for the year. Again, with virtually identical coverage. And then moving along, we just wanted to give you some quick claim examples. I started with the easy one first because I like to have my dessert before dinner. Just again, if there is an employee is covered by a $5,000 high deductible plan, $50 office copay, and a $4,500 GAP plan. If somebody was admitted into the hospital for surgery and incurs a large charge, $10,000, GAP would apply a $500 deductible and then pay the $4,500 of its GAP benefit. And then the major med would kick in and pay the $5,000 remaining so that the employee out of pocket would be $500. Obviously, that's a nice and clean one. However, we wanted to give you a slightly more complicated example. So again, same exact plan design. Somebody goes in to seek treatment at their doctor's office. They incur $250 of lab tests, $500 of x-ray, $100 for crutches, and $250 for office visit charge. GAP would apply the lab tests, x-ray, and crutches up to the $500 deductible and pay the remaining balance, that $350. And that's adding the 500 x-ray, 250 lab, 100 crutches. That adds up to $850. We would apply the $500 deductible. We would then pay the $350. The $250 office visit charge, again, that would not be covered because that would be covered under the major med under their doctor's office copay. So that would mean that the $350 would be paid to the provider, and that the individual would still have $4,150 remaining left in their benefit. So that gives you an idea of what GAP is, how it works, and how you can go about getting a quote. With that in mind, I just wanted to take a moment and give you God, I did it again, by the way. I did not go to the second claim example. I apologize. I'm trying to multitask, and I'm doing a bad job of it. But we wanted to give you a moment to see if anyone had any questions about the GAP product itself, as well as obtaining a quote and how the program would actually work. Does anybody have any questions or concerns? All right. Like I said, this is pretty simple stuff, not hard. So with that in mind, let's just say that we've knocked your socks off and decided that this is the kind of product that you want to offer your clients, and you've successfully gotten a proposal and the clients have signed off on it. We are going to show you how the program gets fulfilled once a case sells. Once that happens, an individual would be sent a fulfillment kit that comes with their welcome letter as well as their ID card. Once they have that ID card, they should be putting it in along with their major med card. It should be right behind it. And when they go to seek treatment, whether it be at a doctor's office or a hospital or what have you, when they go in, they should hand both ID cards, both their major med and their GAP ID card, to the provider and say, I have a GAP plan, send the bills here as well. And once that happens, that individual should be removed from the equation. At that point, the provider will send the bills to their major med and send it to us. And then we would get a copy of the EOB from the major med. And then the claim is paid off of that EOB. This goes back to what I mentioned, where we follow the major med. So if treatment is excluded from the major med for one reason or another, it would not apply to the gap plan. So we look at that EOB and we say we see $1,000 charge. If we see that $1,000 applied to the deductible, then it applies to the gap. If we see that it was excluded because it was experimental or it was not sanctioned treatment, what have you, elective, whatever the reason may be, then the gap would not pay for it as well. Once the claim is submitted, they would receive an EOB from our TPA. The TPA is called Coordinated Benefit Plans. We've been working with them for years. They are very, very familiar with this product. You probably can't really see the details on this, but it's an EOB just like they would get from any major med carrier. Along those lines, I zoomed in a little bit just so you can get a better look at what you're seeing. So this would spell out not only what was paid, what was denied, what was covered, what was not covered, but if you see down at the bottom, you'll see it will give the accumulators, so individuals will know how much of their gap plan that they've used, how much they have left. So as you can see on this example down here, this individual had a $3,000 gap plan. They've spent $2,154.17 of it, and they know that they have $845.83 left. So we walk people all the way through the process so they can see how their gap is being utilized and what is covered and what is not. So that is everything. So I've managed to sum up my entire career in 22 minutes. So I'll let you decide how disconcerting that is. But like I said, this is a pretty simple product, not hard to get a quote, not hard to explain, and not hard to administer. So what I would ask is that as you're coming up on your renewals, you know, the 12 ones are already upon us, and 1 ones are, if not around the corner, they may be upon us as well. When you see these rate increases coming in, and both you and your clients stressing about it, what I would simply ask is to consider reaching out to us and let us getting you a proposal. We might be able to save you some money, and even if we don't, we might be able to help you out by showing your clients that you've turned over every rock in trying to service them. That's all I got. Alyssa, oh, wait. I knew as I went to you. Do you want to share this last part, or?
Sure. I do have a couple of takeaways for us. So new groups are very easy to implement on our end. We just need the signed proposal, and then of course all the members who will be signing up for the program, and we can really have them turned around within 1 to 2 business days. The sooner the better that you guys know the group is signing up. Just send it over, then we can start the process. And then of course, as far as the ID cards go, we do handle printing them in-house. And if you have anyone who needs a PDF version of their ID card in the meantime, before they get their hard copy in the mail, just simply reach out to us and we can easily email that over. And now last but not least, the grand finale, we are having an Amazon gift card contest for most quotes submitted between October 1st and December 31st. So make sure you get your quotes in.
Yes, we're not above bribery. So there you go. That's it. That's all we have.
I do not see anything in the chat feature. So you must have answered all of the questions that anyone was thinking.
Absolutely. We were so thorough that nobody had any questions. We've covered everything.
Thorough and quick.
Absolutely.
I like it.
Mm-hmm.
Well, thank you everybody again for joining us, and thank you Alyssa and Patrick for giving us all the things you know about GAP and what everybody can do and use for their fourth quarter. And if anyone else doesn't have any other questions, thank you again, and I hope you guys have a great day.
Thank you. Thank you all. Thank you. I hope you have a great holiday. And Alyssa, one last thing is that how do individuals get a copy of the quote request form, and how do they get it to you?
Sure, they can reach out to Courtney or her team, and then of course Courtney and Jackie sends it over to myself, and then I work with David, our underwriter, to get you guys the quote.
Fantastic. Just want to make sure we covered that. Thank you all. Have a wonderful holiday season.
Thank
Thanks,
you.
everyone.